know that there's always something new to learn even after graduation? My name is Abby, I'm a registered nurse, and today I want to talk about the impact that technology has specifically on simulation-based learning in nursing for nurses and nursing students, the array of resources available to those nurses and nursing students continuing their education, and some contraindications in nursing when it comes to technology. So first, let's talk about the simulation-based learning. There was an article posted in September of 2024 by authors Alarumpo and Akimi that they wrote, with the use of simulation technology and advanced medical equipment and devices, nurses and nursing students can now diagnose and treat patients, practice their skills in a safe and controlled environment. Simulation-based learning is highly used every single day in nursing and also nursing school and in hospital settings as well. A type of learning for those is a great opportunity for both nurses that are fresh out of nursing school and nursing students that may not know everything to learn in a safe and controlled environment, while also being able to take care of patients in a clinical setting, but learning from those mistakes before treating those patients. In addition, they also wrote, this is proven as an effective teaching method as it allows students to make mistakes and learn from them without putting real patients at risk, like I just said before. This simulation-based learning is highly effective in a code situation when somebody actually has no life left or their heart stops. I can passionately say that with the use of simulation-based technology and my use of code simulations, that I've helped to be able to save a lot of lives in the critical care unit. So now that we've talked about that, let's talk about the array of resources available to those nurses and nursing students. In the same article I previously mentioned, they also wrote, with the internet, students can access a wealth of information, research studies, and educational materials with just a few clicks. While in nursing school, I relied really heavily on the internet, basically for my finals and to study my boards. There are so many different resources that these students and current nurses can use to gain more knowledge to help take care of patients. It also helps to enhance even current medications and enhance practices that you may have not learned in nursing school. So in addition, those authors also wrote in that same article, this has made it easier for students to conduct research and stay updated with the latest developments in the nursing field. At Christus that I work at as a nurse, there is an array of resources that they are always implementing and encouraging the nurses to try and make sure that they're staying up to date on all of the new technology that's used and all of the new medications, and to encourage us all to basically just get involved in the continuing education to further enhance your practice. One resource in particular that I use every single day is a medication contraindication resource. And basically what it does is it helps to make sure that medications that cannot go together don't get put together. So I use that a lot when giving critical medications in the intensive care unit. So, lastly, let's talk about some contraindications of technology in nursing. There was an article posted on February 10th of 2025 by Kui Wei and others. They wrote, ethical concerns, issues surrounding data privacy, and the importance of maintaining human-centered care represent key obstacles. Data privacy has always been a big thing, and it has currently grown over the last decade with hackers and things like that. Nurses have to be extremely careful to not just step away from a computer while leaving a chart open, or to leave papers just scattered around. So that's one of the big things. Secondly, human-centered care. AI is a huge indication, like it's a huge thing that's been growing and growing and growing over the last several years. But we always have to remember that a robot can't really give the compassion that a nurse has. And even though it's there and it's available, that patient may feel better with an actual human contact. In addition, they also wrote, the rapid pace of technological advancements often surpass the development of regulatory practices or policies, and educational frameworks, creating a gap between AI's capabilities and its practical implementation in nursing settings. This rapid enhancement gives questions, are nurses keeping up with the current practices? At Christus, I'm really thankful that they're able to, again, implement and encourage us to make sure that we're doing those practices and getting that education in. So, today I've discussed with you the impact of technology in a simulation-based setting for nurses and nursing students, the array of resources that are now available through internet and technology for those, and some contraindications of technology in nursing. Like I said earlier, there's always something new to learn, but we might as well use the resources that we have available to get us through it. So, thank you.